Hello and welcome to the UC Irvine Health Transplant Center Waitlist Education class. My name is Kristen Coe. I am a nurse practitioner and transplant coordinator at UC Irvine Health, and it is my pleasure to speak with you today about waitlist management. So today we'll talk about transplant at UC Irvine, how the transplant waitlist works, what to do while you're on the waitlist, what to expect at the time of organ offers, transplant surgery, post-transplant care, living donors, as well as some financial reminders. So let's talk about transplant at UC Irvine. We've been doing transplants at UC Irvine since the 1960s. We do kidney transplant, pancreas transplant, and simultaneous pancreas and kidney transplant. These are our transplant surgeons, Dr. Donald Defoe, who is the chief of our division, and Dr. Hirohito Ichi, who is his partner. We also have 3 excellent transplant nephrologists. We have Dr. Udom Reddy, who is the medical director for our program, Dr. Ekamo Tantasaramo, and Dr. Anthony Ferre. At UC Irvine, we do both deceased and living donor transplants. A deceased donor transplant is a transplant in which the organ comes from someone that has passed away. In a living donor transplant, the organ comes from someone that is still alive. For example, you may hear that a person wants to give a kidney to their brother that is in need. We are also one of the only pancreas transplant centers in Orange County and take great pride in our pancreas transplant program. At UC Irvine, we are a growing transplant center. We did 121 organs between the time of July 2019 and July 2020. During that time, we transplanted 116 kidneys and 5 simultaneous pancreas and kidney transplants. This may not sound like a high number of simultaneous pancreas and kidney transplants, but in fact, this is one of the highest numbers in the region, as these transplants are a bit more rare. At UC Irvine, we are also very proud of our transplant outcomes. This data that you see here is from the Scientific Registry of Transplant Recipients, or the SRTR. You can look this up online at any time, but basically this is a registry that keeps tabs on transplant centers to ensure that they are performing good quality transplants. And so you can see here that UC Irvine is doing well. One of the other things that we take great pride in at UC Irvine is that we provide individualized or personalized care to our recipients and our donors. We firmly believe that each patient is different from another patient, that not all transplants are created the same, and that it is our duty to best serve our patients by taking an individualized approach. And so you can see here an abstract from one of the papers that our physicians wrote about precision medicine and taking a personalized approach to renal transplant. So let's now talk about the transplant waitlist. The transplant waitlist is a national waitlist that's managed by UNOS, which is the United Network for Organ Sharing. As of March 2021, there were over 91,000 people that were waiting for a kidney transplant. There were almost another 1,000 waiting for pancreas transplant. And there were over 1,700 registered for kidney and pancreas transplant. These are all national numbers. At UC Irvine alone, our waitlist is over 700 recipients. On average, that number bounces close to around 730 or 750 patients that are in need of transplant. And the average wait time for a kidney in our area is 6 to 10 years. We'll talk a little bit about why that is, but it really has to do with supply and demand. In Southern California, we have a very, very large population. We have a lot of people in need of organ transplantation, but the resource isn't readily available, which contributes to the long wait times. Other major factors that contribute to wait times include blood type, antibody levels, or CPRA, UNOS qualified time, and geography. We'll talk about each of these in a little bit more detail. So blood type impacts a person's wait time because certain blood groups can accept from other blood groups and certain blood groups cannot accept from other blood groups. So this is some information. These are approximate local wait times in our area, Southern California, according to blood group. So you can see that a type O has the longest wait at 10 years because they can't accept from anyone except for a blood type O donor. Type A is about 7 to 8 years. Type B is 8 to 10 years. And blood type AB has the shortest approximate wait time, which is about 5 to 6 years. And that, again, has to do with the fact for matching, they can accept from any other blood type, type A, type B, type O, or type AB. So antibodies, this is something else that has to do with matching and can impact someone's wait time. So antibodies are part of our immune system that recognizes what does not belong to our bodies. They help keep us healthy. They do things like they fight bacteria and viruses to keep them out of our bodies and keep us living long, healthy lives. Antibodies naturally identify anything that's introduced into our body as foreign, such as a transplanted organ. And so naturally, when you want to transplant something into a person, the body will recognize it as foreign and try to attack it. This is why we use anti-rejection medicines at the time of transplant surgery. However, antibodies must be considered in organ matching so that we can best determine the risk for rejection and find the best match that we can. CPRA, or calculated panel reactive antibody, this is a little bit of a complex idea, but it's basically a number that's calculated from your antibody profile. This number helps us to understand how easy or how hard it may be to find a match for you. This number ranges from 0 to 100, with lower numbers meaning that you don't have a lot of these antibodies floating around in your blood that make you difficult to match. Higher numbers mean that you do have a lot of antibodies floating around in your blood that make it difficult to match. So basically, when someone has a high CPRA value, for example, a number in the 90s, like 98, 99, 100, it means that they have a lot of antibodies against other people, and it makes it very, very difficult to find a compatible match. And because these patients are so hard to match, the UNOS allocation system have rules in place that help increase the chances of finding matches for these recipients. However, keep in mind that even with these rules, finding a match may still be difficult. Another factor that goes into wait time is your UNOS qualified time. This is the amount of time that you have been waiting for an organ, and this goes by whichever is longer: the date someone started dialysis, or the date they were put on the wait list in the case that they hadn't started dialysis yet, but still qualified for transplant. Another factor to consider is geography. So as we mentioned, Southern California has some of the longest wait times in the nation, and that's due to our immense population here. Transplant wait times may vary across the United States. Other geographic areas may have different wait times in Southern California. And for this reason, transplant candidates may be on the wait list at more than one center, and we call that multi-listing. So now let's talk about what to do while you're on the wait list. So while you're on the wait list, we want you to stay healthy. We want you to be in the best shape that you can be and the best health that you can be, so that when your time for transplant comes, you're ready to go and do well. So to do this, we want you to have a healthy diet and exercise. We want you to adhere to fluid restrictions and renal diet as recommended by your nephrologist and dialysis center. It's very important that you maintain a healthy weight. This impacts your health as well as your surgical risk during transplant. We also want you to go to all dialysis and medical appointments so that you can stay up to speed on your health and hear the recommendations from your healthcare providers. We want you to take medications as prescribed. Before you get transplanted, it's crucial that you practice and have good habits with your medications. As after transplant, it's going to be vital that you stay on top of taking your anti-rejection medications and other medications to ensure that your kidney transplant is set up for success. We also want you to follow the recommendations of your healthcare team. And we recommend no alcohol. We absolutely do not allow smoking of any kind, which includes marijuana, tobacco, vaping, and we do not want you taking any non-prescription drugs. We also want you to stay up to date on your individual healthcare needs. These are healthcare maintenance items, such as vaccinations, like getting your flu shot annually, and then your cancer screenings. So for women, that may include a pap smear, a mammogram, or a colonoscopy. For men, that may include prostate cancer screening or a colonoscopy. All these items are age specific and dependent upon your individual risk. So we encourage you to discuss these items with your primary care provider and or your nephrologist on a regular basis to make sure that you're staying up to date. We also want you to talk with us. We want you to let us know if there are any changes in your health. For example, any major issues like a hospitalization, heart problems, lung problems, if you suffered a stroke or cancer, anything like that, so that we can evaluate to see if these would be problematic or if there's any further investigation or treatment that needs to be done prior to your transplant. We also want you to notify us of any changes in your contact information, such as your phone number or your address. This is crucial, especially at the time of organ offers. If we are unable to reach you because we don't have your current phone number, you can miss out on an organ offer, and we never want that to happen. It's also important that we know if there are any changes in your nephrologist or your dialysis center, as we partner with them regularly in preparation for your transplant. We also need to know about any changes in your insurance, as this may impact your financial eligibility and your post-transplant care. We also need to know about any changes in your post-transplant caregivers or post-transplant plans, as we want to make sure that you have a sufficient plan in place and the support that you need to be successful after surgery. We also want you to let us know of any times that you will be unavailable for transplant. For example, if you're leaving the state, you're flying to the East Coast or going out of the country, we want you to notify our office so that we're aware that you will be unavailable for transplant. And then we want you to notify us when you return so that we know that you're back in the area and available for organ offers. So while you're on the wait list, we have a team that reviews candidate charts on an annual basis. Depending on your history and your position on the wait list, that team will order tests, labs, and consultations as needed so that we can maintain your testing to ensure that you're ready for transplant. Our team will call and contact you and assist with scheduling these items. Another thing that's important while you're on the transplant waitlist are your quarterly labs. So in order to match you with donors, we need a fresh blood sample from you every 90 days. If you attend dialysis, we partner with your dialysis center to try to prevent you from having to drive all the way over to UC Irvine and get extra sticks. And we will mail the kits to dialysis, and then they send it back to us. If you are not yet on dialysis, in that case, we do have to ask that you come to the medical center and go to the Pavilion 3 outpatient lab for a draw. There is no appointment needed for these visits, and the orders should already be in the computer when you arrive. As we mentioned earlier, it's very important to have a caregiver at the time of transplant. All candidates are required to have someone to help care for them after the surgery. Recipients will need someone to drive them for at least the first month after transplant, as you will have a fresh surgical wound and should not be making major movements, and maybe on pain medicine that you should not be driving with. In the beginning, it'll be a minimum of 2 clinic visits per week, including labs at 7 o'clock in the morning, and then you stay and see our team for a visit. You usually don't leave until around lunchtime. So in the beginning, it's a lot of visits and it's a lot of hours with us. However, as you and the kidney or pancreas continue to progress and do well, these visits will start to cut down to the point that we're seeing you about every month or every 3 months. And it is important to note that if candidates do not have a sufficient caregiver or plans in place, a transplant may be postponed. And again, this is because we want to make sure that we are setting yourselves as well as these organs up for success. So now let's talk about organ offers. So organ offers are when we call potential recipients to say that we may have an organ for them. Some of these offers happen very quickly. Other times they may go on for a few days. However, ultimately, once we're offered an organ, we have 30 minutes to respond. We do our best to reach out to patients as soon as we are able to notify them that something may be in the works and that they should be expecting a call. However, sometimes calls happen very quickly and they say, we have an organ, you have 30 minutes. So please keep in mind that you do need to be available. These offers can come any time of day. They come 24 hours a day, 7 days a week, 365 days a year, weekends and holidays. Please also keep in mind that we may or may not receive several organ offers before you're actually transplanted. So this means that we may call you and say, hi, your name came up for an organ offer, and then that one may actually not go through. And we may have to do this several times before something pans out. There's various reasons why these organs may not go through, but please don't lose hope, as the fact that your name is coming up and if we're calling you like that, it's usually a good indicator that something is going to come soon and it will stick. Other times it may be the first time that we call you, so please be prepared for that as well. So at the time of organ offers, we want you to know that the calls will either come from a UC Irvine phone number or a blocked phone number. Our coordinators take call home with them because they're on for 24 hours a day, and the call phones that we use are blocked phone numbers. So please make sure that your phone is available to pick up these phone numbers. We know that there's a lot of spam phone calls out there, and I do apologize for that. But please just be mindful that if you are on the transplant list, it may be a blocked phone number that's calling you. We do have interpreters available 24/7. We can get an interpreter on for a phone call at any time, and we use them regularly. So please don't be afraid to ask if there's not already an interpreter on the line. We are happy to get interpreter services any hour of the day. So reminders for you are to please keep your phone charged, keep the ringer turned on, including while you're sleeping, and check any missed calls or voicemails right away. We always do our best to get a hold of patients, and we'll continue calling and calling and calling you and or any additional contacts until we can reach you. But taking these measures will help us be able to reach you at the time and also hopefully prevent you from missing out on any potential organ offers. When we talk about organ offers, there are also different things to consider as far as the types of organs that may be offered. So these are things that were likely already discussed during your pre-transplant education, but it's probably been a while. So I'd like to take this opportunity to remind you about some of the different organs that may be offered. KDPI greater than 85% organs are organs that, KDPI is Kidney Donor Profile Index. So this KDPI is a number that's basically given to organs based on several donor factors. And it's a tool or a calculator that we use to try to predict how long a kidney may last. So the idea here is that higher numbers may not last as long as those with lower numbers for KDPI. However, some of these kidneys with the higher numbers are actually very good kidneys and are still able to be transplanted. And we usually offer these kidneys to older candidates with the hopes of getting them off dialysis and transplanted sooner so that they have better quality of life and hopefully reduce their risk for mortality with staying on dialysis longer. Another type of kidney that may be offered is a public health service risk criteria organ. What this is an organ in which the donor had known behaviors that may increase the risk for transmission of diseases like HIV, hepatitis B, or hepatitis C. In all these cases, our physicians and our team have reviewed the cases thoroughly to determine if we feel that an organ is too accept or not. If it's too high risk, we're not even going to offer it to you. If we feel that it may be an acceptable risk, we will call and discuss it with you. Please remember that all donors are thoroughly tested for these diseases. And if they are positive for any of these at UC Irvine, we will not offer it to you unless you've consented for something like a hepatitis C organ. However, even so, even with all of this testing and all the due diligence that we can take, there's always a small theoretical risk for infection and transmission, which is why we have to talk about this. So now let's talk about the transplant surgery. So when we call you for an organ offer and we say, we have an organ for you, it's time to come to the hospital, we want you to bring all of your medications with you so that we can see exactly what you're on. We also want you to bring any other medical supplies that you use on a daily basis. And then any glasses, hearing aids, are things that you may need in order to sign consents or communicate with your healthcare team. We also want you to have loose fitting clothing, as you're going to have a surgical incision over your lower abdomen, and we want you to be comfortable on your way home. It's also important that you bring your caregiver or your support person with you so that they can support you at the time of surgery and begin the education process in preparation for getting discharged and your post-transplant life. So when you're admitted to the hospital, you can expect visits from the medical team. You will have some labs drawn. You will have dialysis if needed, and then you will be asked to sign some consents and paperwork. This is a diagram that shows where the kidney transplant is actually done. So one of the misconceptions is that we remove your old kidneys and put the new kidney where one of your old ones was. This is not true. We actually leave your old kidneys in your body unless there's a reason to remove them. And then we put the donor kidney down near your hip bone. After surgery, you can expect to be in the hospital for about 5 days. Some recipients may stay longer for various reasons, and we will discuss that with you if that's the case. During your inpatient stay, you will also see many healthcare professionals, such as doctors, nurses, pharmacists, social workers, dietitians, and several others. You will have daily teaching and education to prepare you for your new life with this kidney or pancreas transplant. And we want you to get out of bed as soon as possible, as soon as reasonably possible, according to your team, so that we can make sure that you're regaining your strength and getting ready to go home. For post-transplant teaching, we will come by and our team will talk to you and your loved ones about how to take care of your newly transplanted organ and how to best care for it. We will be providing you with a blood pressure cuff, a thermometer, a blood sugar monitor if needed, a container for measuring urine, a pill box, your new medications, and a medication list. After discharge, as we already mentioned, there will be frequent visits in the beginning. You get to the lab at 7 a.m. and then you'll see the team. This happens at least 2 times a week for the first month, and then the visits start to taper down so long as you and the organ are doing well. You are not allowed to drive until you're cleared by the physician. That's approximately 1 month. And then, as we mentioned before, you will require assistance at home and with transportation. Let's talk about medications after transplant. So medications are vital to help prevent rejection of this new beautiful gift that you've received. Most of the patients will start on about 7 to 10 new medications after transplant. and you have to take most of these for the life of the transplant to prevent rejection. Some medications we will take off after a few months. However, your immunosuppression or those anti-rejection medications must be taken for the life of the transplant. Please keep in mind that if you skip medications, so you miss doses, or you change or adjust the doses on your own, you risk losing your transplant. So please, please practice good medication habits now and call us anytime. Work with your team to ensure that doses are appropriate. Please also keep in mind that it is the patient's responsibility to be aware of any medication costs or co-payments. So we strongly encourage you to call your insurance company prior to transplant to discuss any payment. Here's a list of commonly used medications after transplant. And this is the list that we would encourage you to ask your insurance company about to see if there are any co-pays or any financial responsibilities for the patient after transplant. Now let's talk a little bit about living donors. So again, a living donor is a healthy person that gives one of their organs, such as a kidney, to someone in need. Donors must be over 18 years old, so they must be adults, and they must be in good physical and mental health. Donors can be a friend, they could be a relative, it can be someone completely unrelated. Matching with the donors is not the responsibility of the patient. That's our job. So please, if there is anyone that may be interested in being your donor, you can have them call our team or fill out our donor application online, which will be provided shortly. And then let our team worry about the matching aspects. This is just a reminder that all donor and recipient information is confidential. Please remember that we cannot discuss any living donor's case with the transplant candidates, and all living donors are treated as individual patients. It's very important that we keep the safety and privacy of both of our populations for donors and recipients as separate as we can to make sure that we're providing the best care that we can to both individuals involved. And anyone that's interested in becoming a living donor can complete the online questionnaire at this URL. And if there are any questions about living donation, we have a wonderful donor team, and they're available by phone at this phone number. And lastly, let's talk about a few financial reminders for preparing for transplant. So before transplant, it's important to be in touch with your insurance company so you can know exactly what to expect financially in regards to transplant. Some things to consider asking are about the cost of surgery, the cost of staying in the hospital, the cost of any outpatient visits or labs, medications, and you can ask them if there's anything else that you should be concerned about or prepared for financially. Again, we want you to contact us with any changes in your insurance, as this may affect your transplant at UC Irvine, and we want to make sure that we take care of any financial issues prior to your transplant. This is a reminder to check your medication coverage before transplant so that you can know what to expect. And then we also want you to know that you should not receive bills for pre-transplant evaluation items done at UC Irvine. This is for both donors and recipients. So if you receive any of these bills, please be sure to call our financial team so that we can help rectify this situation. Here's our contact information. The transplant team, we are available Monday through Friday, 8 to 4:30. This is the phone number for the main office. And we also have our team available 24 hours a day for organ offers and for emergencies after transplant. So thank you so much for your attention today. We just want to remind you that transplant is a treatment option and it's a choice. And it is a choice that requires a lot of commitment and hard work, both before and after surgery. But we are on the same team with the same goal, which is to provide you with a successful transplant so that you can achieve your health and life goals. And we're here to help you and serve you in any way that we can. So thank you so much for your attention today, and please feel free to reach out to us at any time if there's any additional questions or informations we may provide to you. Thank you.